Thank you. The next question is a little bit more complex, I think. California Assembly member Ricardo Lara, the Latino caucus leader, proposed to enroll all illegal aliens in the California healthcare system, which is against federal policy. What is your position on this? And we will begin with Mr. Love.
The issue at hand, to sort of understand what the intent of the legislation is to allow for an opportunity to have what I would say not illegal aliens, but those that are undocumented and living in our communities, to access public services that we are all equally afforded. And so, because I don't know the details of that particular legislation, I appreciate the intent of what the legislator is trying to do, which is how can we have an inclusive opportunity for all to then use the social services that we have in our community, so that people don't fall through the cracks. And I think that's the intent, which I think is important. And so obviously I have to read the details, and I can't speak specifically to those details. But what I can say is that I sort of understand the intent of what the legislature is trying to accomplish.
Thank you. Mr. Page?
Thank you. I'm not familiar with all the ins and outs of this legislation, but I do think it sounds a bit on the extreme side, especially if it violates federal law. Why are we dipping our toes in there? We've got enough of a healthcare problem in America right now, and in California. I discovered 2 weeks ago when I went to an urgent care facility that my Blue Cross plan that I'd been on last year, and they gave me a new card this year and doubled my price, or 150% increase in rates. Turns out it's a covered California plan. Even though it says on the website that I could go to this place, I couldn't. So how many more people do we have to put on the plan to find out that it's not an effective solution? I think that the problem that we have has to be fixed before any attempt at putting every person that's in our state illegally on some form of health care. Plus, we've got other problems. If you look at things like O'Connor Hospital, they get a lot of runoff of emergency cases. They only get paid about 20% of what Valley Medical gets paid from the state of California for Medicaid patients.
Thank you. Mr. Chang?
Illegal residents, they should not be paid. If they're illegal, they're illegal. The state has to take care of the legal resident first. We are way behind, as Council Member Page mentioned about. We are number 47 on the education spending. If we don't raise our education funding for our kids, we are going to get behind, because education is the one help us get ahead. And so, with the limit budget, and then if someone's illegally getting into this country, I don't think they deserve it at this point yet. Unless we have plenty of money, amount of money, then we can take care of. But has to take care of the legal resident first, in my opinion. Thank you.
Thank you.